Hey everybody, like Emily said, my name is Dustin Pugel. I'm a senior policy analyst with the Kentucky Center for Economic Policy. And I'm going to start us off here in just a minute. But before I do, I just want to acknowledge that this is a webinar about COVID-19 and our state's response to it. But we also are very aware that there's a lot going on in the world right now, and that fundamentally racism is a public health crisis. The murders of Breonna Taylor and George Floyd are the result of a very long history of structural racism that creates persistent inequalities when it comes to health and employment, education, housing, and wealth, and so many other things. And those deaths and far, far, far too many others are really a manifestation of a system that inhibits the ability of Black Kentuckians to live in security and safety and health. And so as we go through these slides, we are going to try and stay focused to some degree on our state's response to COVID-19, but we also just want to make sure everyone understands that when we ensure that there's an equitable distribution of food, when we ensure that everyone can get to a doctor when they need to, when we can make sure that everyone has access to a home where they can be safe, that they have access to legal services, we ensure that to a degree we start chipping away at those systems and start moving in the right direction. So there's a lot more we could say about that and probably should, but for the purpose of our time together today, we'll go ahead and get started. So let's go on to the next slide. So I think a lot of folks have heard recently that there has been a really catastrophic decline in jobs. And although it's important that we make sure people stay at home and that we closed places where COVID-19 can spread more easily, that did result in a lot of folks being sent home. And so the number of jobs in Kentucky dropped by nearly 300,000 people in 1 month. If you look at the bar across the top, that's month over month job change. Right there in the middle, that little clump of red bars, that's the Great Recession. In March, we exceeded the job loss of the Great Recession, and in April, we really hit an uncharted sort of territory in terms of job loss. 15% of folks were sent home without employment, and given what we know about unemployment insurance, it's likely much larger. So let's move on to the next slide. And we also know that there are parts of the state that were hit harder than others. Interestingly, with the types of jobs that were lost during the COVID-19 crisis, it hit urban areas harder than rural areas by and large. So the counties around Bowling Green, counties around Louisville, the counties around Northern Kentucky, and some counties in Central Kentucky really got hit hard. And that's largely because industries like arts, entertainment, recreation had over a 50% decline in the number of jobs. Accommodation and food services, which is hotels and restaurants, had a decline of nearly 70,000 jobs, or 4 out of 10 workers. Manufacturing declined by 30%. And healthcare and social assistance sector, which does include CNAs, nurses, and doctors, but also includes childcare workers, also had an enormous drop, which I don't know if we can see on the screen. It's at the very bottom, but it was over 30,000 folks. And again, just understanding what this means practically, although it's true that some parts of the state were hit harder than others, it's also true that people of color disproportionately work in these industries that were hit hardest. And so we know that there was a disparate impact on folks who probably had less of a safety net to begin with, which really underscores the importance of our safety net and why we need to make sure that these programs are working for everyone and that they're widely available and that there is few barriers as possible to getting and using these forms of assistance, especially right now. So with that, I'll hand it over to Jessica.
Hi, everybody. I'm Jessica Klein, a policy associate at the Kentucky Center for Economic Policy. I'll be talking about food assistance and our different programs to help with food access. Next slide, thanks. As of 2020, it was estimated 1 in 7 Kentuckians, which is about 750,000 people, are food insecure, meaning they don't have adequate and consistent access to the food they need to thrive. And in Kentucky, we have almost 600,000 participants of the SNAP program, the Supplemental Nutrition Assistance Program. This chart goes back to 2006, but I really just wanted to point out the sharp incline towards the end, which is COVID-19. And we've seen an increase of over 110,000 Kentuckians using SNAP to buy groceries during that time. The increases come from all kinds of counties, including the most from Louisville and counties like Magoffin and Lee. As COVID pandemic continues and we see more closures of businesses, people losing jobs and wages, we expect the need for these benefits to increase and people to use more of these benefits to access the food that they need. Next slide. So there's been a lot of state and federal changes to the SNAP program recently, so I kind of just wanted to go over those. A few things have been done to address the growing need of SNAP for those 110 additional Kentuckians using SNAP over the past few months. We've been approved for the emergency SNAP program, which provides an additional $28 million in extra benefits to existing households. And that's over 154,000 households that already participate in SNAP that received extra benefits in April and May, and we're seeing those continue for June. We've also seen an extension in our recertification of these programs for 6 months. For example, if your recertification is up June 15th, you won't have to recertify until December 15th. There's been a lot of flexibilities within the program as well to make it easier to stay on SNAP if you're already on SNAP. They're minimizing in-person appointments, self-verifying income, and treatment rather than complicated documentation requirements. Work reporting requirements for adults who report hours worked or volunteered have been waived, and SNAP EBT can now be used online to have groceries delivered through Amazon or Walmart or for pickup with Kroger ClickList. More generally, these steps being taken are to alleviate the stress on the state and to make it easier for folks to get the benefits they need. We've seen extensions in call center times, delayed requests for information, and working on expedited SNAP applications. All of this to say that these many new policies and program flexibilities are great. And so even if you've been denied before, consider applying. Previously ineligible people may now qualify. And these programs have helped to booster SNAP as a safety net and stimulus program, but more is needed. In the next COVID-19 bill, we would like to see Congress increase the SNAP maximum allotment by 15%, which would ensure everybody sees an increase. This would provide an additional about $100 for a family of 4 per month. Next slide. One of the most recent changes has been the Pandemic EBT program, or P-EBT. It's for kids whose schools are closed, but they used to participate in free or reduced meals at school. And that's over 500,000 kids in Kentucky. It's estimated that this will provide an additional about $313.50 per child. And it's kind of a one-time payment to make up for that loss of school. And it doesn't change your ability to apply for other programs. So definitely if you know children who are eligible because of their participation in free or reduced price meals, they should definitely apply, regardless of income, whether they go to a public or private school, or schools where every child is eligible. So for this kind of how you apply, for people who already have SNAP, they will see these automatically on their EBT card. For those participating in KTAP, foster care, kinship care, or Medicaid, they will automatically receive an EBT card with these benefits on the card. And for families who don't participate in any of these programs, they have to apply online, and this is the link to the Benefind website. It's a really short application. It's due by June 30th, and all you really need is your student's name, date of birth, and student ID. Next slide. So a few other nutrition programs in Kentucky. We have the Women, Infants, and Children program, WIC, which is for postpartum and breastfeeding mothers and children under 6. We have over 100,000 women and children that participate. They've done a lot of administrative flexibilities as well in this program, minimized in-person appointments and doctor's requirements and that kind of thing. Benefits can be renewed remotely, and for things that are difficult to find in the grocery store, they've provided some flexibility around nutrition requirements for the food you can purchase with this program. Yeah, for this, we would also like to see certifications extended because that is another barrier to receiving these benefits. You can contact your local health department to find a WIC program near you or to learn if you're eligible. For seniors, it's now estimated that 17% of Kentucky seniors are food insecure. So our senior programs are extremely important. And these are really regional programs. They're administered mostly by area agencies on aging for congregate meals, which is when people would go to a senior center to eat together, but those are now available by delivery, and Meals on Wheels continues to deliver. Next slide. For students, there have been many waivers for this group as well to make sure people are able to get the food they need for kids during this difficult time. The number of summer feeding programs have extended to new locations, so it might be hard to find a location, but you can find it on this site tracker. You can also text food to 877-877. And again, even if you participate in the P-EBT program, you can still go to one of these sites to pick up free food for kids. Next slide. And just as an additional resource, people can access emergency food through the 800 local food pantries we have in Kentucky. There's been a huge increase in need. Food banks have seen over 50% more people than they have normally. We've deployed the National Guard to help with this and opened additional food sites where we normally wouldn't for emergency commodity foods. There's been program flexibilities within this as well, including increasing the income guidelines to 185% of the federal poverty line and practicing social distancing for these groups as well. So to find a location near you, you can go to this Feeding Kentucky website. And I think it's on to Emily to talk about health.
Great, thanks, Jessica. So again, I'm Emily Beauregard with Kentucky Voices for Health. We can go to the next slide. So before the COVID-19 pandemic started in Kentucky, we actually had 223,000 Kentuckians living without health insurance. And that's despite all of the gains that we've made with the Affordable Care Act and getting people covered by Medicaid expansion. But since that time, since March, Kentucky's rate of uninsured has more than doubled. The most recent estimate that I've seen here in Kentucky is that we have about 233,000 Kentuckians without health insurance, but that's an estimate that is based on our rate of unemployment, because primarily the people who are losing losing health insurance, who are becoming uninsured, are losing employer-sponsored health insurance. And you can see that the Urban Institute has estimated a range of ESI losses from 233,000 to 438,000 Kentuckians who could potentially be losing their employer-sponsored health insurance and become uninsured. So when we look at the graph on the right side of your screen, you can see what these estimated changes are based on that level of unemployment. In the key, you'll see 15%, 20%, and 25%. And that first column is employer-sponsored health insurance. You can see that decline going close to 500,000 Kentuckians at the highest level of uninsured. But that next set of columns is Medicaid. And Medicaid is really designed to absorb these losses. It's designed to react to this type of economic downturn and cover more people. And it does that best when people know that they're eligible for Medicaid and when we make sure that people are getting enrolled in Medicaid and not remaining uninsured. You can also see that marketplace coverage is expected to increase, as is the rate of uninsured. We will still have some people who remain uninsured. But as I said, as Kentuckians lose employer-sponsored health insurance, most will be eligible for Medicaid or a subsidized health plan. And it's really critical that we do what we can to make sure that people get enrolled. So let's go to the next slide. I think this is what people need to know most right now. Because we're in a state of emergency, applying for Medicaid is faster and easier. Kentuckians who are uninsured and under the age of 65 can use a new presumptive eligibility application for temporary Medicaid coverage that lasts up to 90 days. And this is a graphic that we've been posting on social media. We would welcome you to share it. But we're trying to make this as simple and also make it as public as we can to make sure people know this is an option for them. So what this means is that people with higher incomes who wouldn't typically qualify for Medicaid can get temporary coverage through presumptive eligibility right now. But they're not going to enroll unless they know that they're eligible and they know, how to enroll. So having your help in spreading the word would be great. It's also really important to remember that Kentuckians with incomes below 138% of the federal poverty level can always apply for regular Medicaid at benefine.ky.gov. And if people don't know if they're eligible, it doesn't hurt to apply. So the fastest way to get coverage is through presumptive eligibility, that temporary application. And the link is there that you can click on and go directly to it. People will get enrolled more quickly and they'll have fewer documents or no documents actually that they have to submit in order to be eligible and to enroll. But if people need longer term coverage, they should apply for regular Medicaid. And something else that the state has done to make that application simpler for regular Medicaid is they've created an inbox, an email inbox, where people can email their documents for verifying their eligibility for Medicaid. So you can see that email address there, and it's important that people put their full name in their Medicaid ID, but sometimes people don't have access to Benefine, they don't have the account, or they can't log in, and so this makes it simpler. We can go to the next slide. A few other Medicaid changes to be aware of during the state of emergency is that coverage has been extended through the state of emergency. That means that no one can be disenrolled from Medicaid unless they request to be disenrolled or they move out of state. No one should be receiving RFI letters. That stands for request for information. So that's when you have to prove your income or maybe that you lost a job, things like that, your address. These should not be mailed out right now, and people shouldn't lose their coverage for not submitting that information. No one should be charged a copay. There are no prior authorizations that are required right now in order to get services. And there are more options for telehealth than ever before. And I think that Dr. Sheila Schuster will be talking a little bit more about that. But people have the option to stay at home, stay healthy, and have services via telehealth, and should really take advantage of that. There are also options to have prescriptions filled for a longer period, so typically 30 to 90 days, and for prescription delivery. We can go to the next slide. Now, you may have heard that the new MCO Medicaid contracts or Medicaid MCO contracts were announced last Friday. These were awarded to 5 companies, Aetna, Humana, Molina Healthcare, United, and WellCare. Now, 3 of those companies were already operating here in Kentucky. The 2 companies who did not get contracts were Anthem and Passport. And Anthem and Passport members will have the option to choose a new MCO. We don't know exactly when that will happen, when there will be an open enrollment period, but these contracts, the new contracts, won't go into effect until January 1st of 2021. So we have some time to figure that out, and on another monthly update, we will definitely share more details. It's also good information to know that Aetna was awarded the Kentucky Sky contract, and that's specifically to serve children in foster care in the Department for Juvenile Justice. And the new MCO contracts include incentives to address social determinants of health. We don't know what those incentives look like yet, and we don't know what social determinants are going to be addressed, but we hope the advocates will have the opportunity to have input into that decision. So we can go to the next slide. Finally, I just wanted to share a few specific updates about COVID-19 related services. As part of the Families First Coronavirus Response Act, which was passed in March, COVID-19 testing should be free for everyone. But we've heard that some people are being charged. That's not unusual, but we want people to know that they should not be charged. If you get charged after the fact, then you can file a complaint with the Department of Insurance, and that link will take you directly to the complaint page. We were told that filing it online is better than calling, but if you would prefer to call, there's also a number on that page. But definitely let us know about that and make sure to file a complaint, because that shouldn't be happening. You can see all of the testing locations that are throughout Kentucky. This is a map from the governor's KY COVID-19 website, and this is updated with information on testing locations daily or weekly. You can go onto that website at that link and see the actual location information and contact information. But we're really, really encouraging everyone to start getting tested on a regular basis and share this information. It's the only way that we're really going to continue to manage COVID-19 until we have a vaccine. So something else that I wanted to make sure everyone knew is that Medicaid and Medicare are waiving all cost sharing related to COVID-19 services, but not all commercial insurance carriers are. Most of them are. We've heard that many of the large ones have decided to waive cost sharing, not all of them, but that has been progress. And we've also seen that most providers are doing visits now by phone or video, not just with Medicaid, as I mentioned before, but with commercial carriers as well. So those are things that we want people to be aware of. That's, I think, all that I wanted to cover with these slides, but I'm happy to answer questions later in Q&A. So we can move on to the next person who, if we can go to the next slide, Angela. I'll turn it over to Dr. Sheila Schuster.
Thank you, Emily. I'm a licensed psychologist and the chair of the board of Kentucky Voices for Health. And I'm pleased to be talking with you today about behavioral health. By that, we mean mental health and substance use disorders primarily. Next slide, please, Angela. So the first thing I want to say is that behavioral health services are available across Kentucky. For those of you who have been seeing a therapist or counselor, or have someone in your family who has been seeing a therapist or counselor, you're used to going into the office and seeing them face to face. That's not been possible during the COVID-19 pandemic, but instead, almost all of those therapists or counselors, the clinics, the community mental health centers, the outpatient clinics that the hospitals run, are providing those services through telehealth. And telehealth is just a fancy way of saying you can use your computer, you can use FaceTime on your phone, and if you don't have even a smartphone that does FaceTime, you can actually at least have an audio voice-only session with someone through your phone. So years ago, the federal government enacted protections for the privacy of patients, and there are certain rules that apply to telehealth. They have been largely suspended because of the crisis. So many more communication avenues are available, as I mentioned. As Emily just mentioned, Medicare, Medicaid, and most private insurances are suspending copays. And that also includes state employees, state retirees, and teacher retirees in Kentucky. There are no copays, and all telehealth services are being made available through those insurance payers. So telehealth is offered, the community mental health centers cover all 120 counties. They have therapists and counselors available. We have many private providers, psychologists, social workers, counselors, psychiatrists, and so forth, and also many clinics. And they're using a variety of those computer platforms like FaceTime or even a telephone. So if you are currently in treatment, or someone in your family is, you've probably moved over to telehealth. If you are feeling like this is a time when you need some outside help with behavioral health or an addiction, then contact a private provider, a community mental health center, and they will get you set up to see someone remotely through one of the telehealth platforms. Also, for those who are struggling with addiction issues, the 12-step programs, the Alcoholic Anonymous, the Narcotics Anonymous, are all available online and should be available through Facebook as well. Next slide, please. There we go. So this pandemic is what we call a trifecta of anxiety. So if you didn't have anxiety before the pandemic struck, you probably have a good dose of it now. And it's really three factors. It's the unknown duration, how long is this going to last? It's the feeling of a loss of control over so many aspects of your life, and a sense of great risk. So the risk comes first, I think, in terms of wanting to protect ourselves and our loved ones from getting ill with the virus. And it's an insidious and undetectable in many ways virus. And we've lost over 100,000 lives in this country, sadly, to it. So there is a sense of great risk. Some of you have been experiencing not only the risk, but the reality of losing your job, or at least temporarily losing your job. If you have children in your home, they've had the great risk of losing contact with teachers directly, with friends, and with education delivered in a more typical way. And I've had to master a computer and try to get their education done that way. I would also add that this is a time of terrific anxiety because of the racial unrest, the not knowing what's going to happen. Will protests be peaceful, which is what we all hope for and support? And will it boil over into more violence and property destruction? If you live in an area where there's been a number of protests, I talked with someone the other day who lives in downtown Louisville, and she said she is so anxious because of the constant hum of helicopters overhead and drones overhead, some from the police, some from bystanders, some from the media outlets. So just that constant noise and reminder that there's great unrest. So acknowledge that. This is a time when there are significant mental health challenges. Anxiety and depression are probably the most common symptoms. And your children get affected by those as well. We tend to want to protect our children by acting like it's not happening to them or that they don't know what's happening. And the truth is that even fetuses in utero pick up the anxiety and the stresses of their mothers. So talk about how you feel, put language to it, put terminology to it, listen to others, and then get help if you feel overwhelmed. It is not a sign of weakness. Our governor has done a terrific job in his press conferences about encouraging people to get help, to not be stopped from that because of the stigma that's been attached to mental illness and treatment for substance use disorders. As is true with physical symptoms, anybody that has a pre-existing mental health or addiction issue is going to be likely to show more significant symptoms and have more difficulty in coping. So yourself, your history, the history of those that are in your family. And if there has been mental health issues or addiction issues, look for those and be ready to offer help or to get professional help for yourself or for others in your family or in your network. Sometimes it takes a good friend to say to someone, I'm really worried about you. You seem to be really having difficulty just coping on a day-to-day basis. And then some simple things that we could do. Daily exercise is a wonderful natural antidepressant. It releases brain hormones and chemicals that get you going. So taking a brisk walk even walking around your house when your kids are there, if you can't leave your home, get yourself a little walk around, get some daily exercise, stick to a routine. Don't let yourself fall into your days and nights getting reversed because you are afraid to or uncomfortable going to bed and then staying up until you just fall into bed with exhaustion almost at the morning time. So stick to some routine, even if it's a check-in with others. Let's talk at 10 in the morning and make sure that we're up and going. Let's check in with each other again at nighttime. Minimize alcohol use. Alcohol is actually a natural or chemical rather depressant. And even though it may numb some of the feelings at the time, it actually leads to further depression and difficulty in sleeping. And then reach out and connect with others. One of the best antidotes to your own depression is to reach out and help somebody else. And particularly at this time of racial unrest, think about people that you may know in the African American community or somebody in another community of color who may be feeling very isolated, very threatened, and very much at risk. Is there something that you could do just by way of a text or a way of a phone call? Thinking about others, I think often helps us deal with our own issues. So again, I just want to encourage you that if you're feeling anxious, if you're feeling depressed, if you're feeling overwhelmed, those are very, very natural at this time with the pandemic and then the added unrest that's going around and the anger and sadness connected with the racial inequities. So acknowledge that, talk to somebody, label it for what it is, and be there for yourself and for others. Do not be afraid to reach out and get some help for yourself. My email is at the bottom of the thing. I'm happy to direct you to resources in your community if anybody needs help with that. And I'll turn it over to our next presenter.
All right, so we wanted to cover a little bit about what's been going on with unemployment insurance and some of the recent changes to it that people can avail themselves to, and then also what folks' rights are in response to some of the return to work orders. So we can go on to the next slide. So, you know, kind of like the first slide I showed with respect to jobs, this giant blue bar here on the right-hand side is not a slip of the mouse or an axis. That's actually the number of unemployment insurance claims that have been filed in the last several weeks. The last available numbers that we have showed that 53,000 Kentuckians applied for initial unemployment insurance claims. To put that in perspective, during the whole year of 2019, the average number of claims that were applied for was 3,000 per week. So we were 50,000 over. And although that's a lot, that's less than half of the peak, which was around 117, 116,000 initial claims. Again, like the last chart, the little bump there on the left-hand side, that's the Great Recession. So in the depths of the worst part of the last recession, that, you know, those were the initial claims. And what we've experienced has really dwarfed it. And again, that's important in some ways. That demonstrates a policy win because we wanted people to stay at home, to remain healthy at home. But at the same time, it also reflects the very real hardship that folks are facing right now. Continued claims, which are those folks who ask for a second or more payments, was around 250,000 and has been for the last month, roughly. And cumulatively, since this began on March 21st, 844,000 Kentucky workers have applied for benefits, which is roughly 43% of the whole workforce. I don't know that we have like really solid numbers for the Great Depression, but I feel pretty confident that that exceeds sort of the trough of joblessness, you know, back in the 30s. So let's move on to the next slide. So just a few policy updates. Back in March, the Families First Coronavirus Response Act passed, and I don't need to get into a lot of the details around it. Just specifically know that there were several enhancements that were provided to states to be able to provide benefits at a lower cost to states, trust funds, and employers if they made certain changes, which Kentucky did. Kentucky waived the waiting week. Kentucky was able to adopt an alternate base period to broaden the number of reasons why people could get unemployment insurance. And that was all passed in a bill called Senate Bill 150, which is something that I worked on, that Kara really busted her butt on when she was still with the legislature. And it was an important piece of authorizing legislation. At the same time, I think it's important to acknowledge that there has been just an enormous backlog of cases. There are folks who applied for benefits back in March who have still not seen a dime or have gotten any information about whether or not they were approved. That is the result of a near perfect storm of circumstances around the state needing to implement about 6 new programs in the matter of weeks when they normally have months to implement one program, an unprecedented level of applications, and that really can't be overstated. The fact that they had 12 people answering phones when this started and had to hire 2,000 people to do that and get them trained and put them through a 2-week training program when it normally they have about 6 months to train them. And then also a fairly old system that is not built to handle this number of claims or even this number of new programs. It still runs on a coding language from the 70s. So, there is an enormous number of factors that go into the fact that a lot of people have not been able to get really needed income. And that doesn't change the severity of what they're facing, but it is sort of the reality that we have. So having said that, I mentioned that there were several new programs. 3 of the biggest ones were passed in the CARES Act. The first is what's called Pandemic Unemployment Compensation, which is that $600 extra per week for both UI and Pandemic Unemployment Assistance claimants. I'll explain PUA in just a minute. That is a really important benefit, not only for individuals to be able to keep their lights on and feed their families and continue to, just make ends meet. It's a really important program for the broader economy. A lot of research shows that SNAP and unemployment insurance are sort of the 2 best responses we have to recessions, and that the more we deploy in unemployment insurance, the fewer jobs are lost in the long term. So providing a lot of extra benefits right now is a way of making sure that not only the people who have currently lost their jobs can make ends meet, but a way of preventing further job loss by ensuring that there's enough money moving around in the economy. At the depths of the Great Recession, I can't remember the numbers off the top of my head, but certainly tens of thousands of jobs were saved because of a normal UI program. So adding money to this is really important for the rest of Kentucky workers. Pandemic Emergency Unemployment Compensation, or PEUC, is an extra 13 weeks of unemployment insurance benefits that are provided after states exhaust their regular UI benefits. And that's important because it's fully federally funded, whereas our normal UI benefits come out of a trust fund. And once that trust fund is used up, which I expect every state in the countries will be, we'll have to take out a loan and start paying that back, just like we did during the Great Recession. So it's helpful that that is a federally funded program that I'm sure we'll be using very soon if we haven't already started. And then Pandemic Unemployment Assistance, or PUA, is the jobless benefit for self-employed, independent contractors, freelancers, part-time workers, and workers with spotty job histories, sometimes called gig workers or others. So these are the folks who would not actually receive any benefits under a normal UI program and typically don't, but Congress opened it up. It's less generous than unemployment insurance, but with the extra $600 a week, it makes up for a lot of that. So the average benefit tends to be somewhere around $780 combined. We'll get into this a little later, but these programs are at risk of stopping unless Congress takes action. And again, I think Kara is going to cover some of that later. So let's move on to the next slide. Oh, actually, I can cover it now. I'll be brief though. Pandemic unemployment assistance is extended in the HEROES Act, which was passed by the House and is now waiting discussion in the Senate. It extends it from January all the way through January 31st, and that for people who are already receiving PUA, that could extend out to March 31st if they need it of next year. Pandemic unemployment compensation is set to expire fairly soon at the end of July, but the HEROES Act would extend it again through the end of January of next year. So I won't get into too much of that because I know Kara's going to talk about it later. Let's move on to the next slide. So there are some things we wanted to mention about what workers have available to them and ways that they can make sure that they protect themselves and their families. And so I'm going to first turn it over to Tyler Offerman and then to Jessica Klein to discuss this part.
Great, thanks, Dustin. And real quick, before we move on, we did have a question about partial loss of employment. Dustin, correct me if I'm wrong. People can apply for UI if they have lost hours or wages, even if they haven't fully lost their job.
I will not correct you because you're not wrong. It's called partial UI. So you can apply for benefits to make up for income that you lost because your hours were cut. Now it will only replace a portion of that, but the law states that if you receive $1 of UI or PUA, then you will also receive the extra $600 a week. So folks would not receive a full replacement for their lost wages and their normal benefits, but they would still receive the extra $600.
Great, thanks. So talking a little bit, about unemployment insurance and workers' rights, there is principle within UI statutes that's called good cause. So good cause for separation basically means that the worker had a good reason, good cause for separation. And good cause is also important as we think about businesses opening back up and if that worker has a good cause to not return to work. Right off the just top of this presentation, I know later we'll talk a little bit about legal aid. If you have questions about UI and you need some advice, I highly advise you seek legal advice for what situation you might fall into, especially because, as many of y'all know, and as we're seeing in the chat, it's kind of hard to get a hold of UI staff nowadays. So real quick, good cause for separation, normally it's only being laid off for no fault of your own. Wanted to point out this long list of special rules during the pandemic that allow workers to qualify for pandemic unemployment assistance, as Dustin already mentioned. There's a long list here. I won't go over all of them. But some important ones that people have been asking about, you can see at point 4, they're providing care for a child or other household member who can't attend school or work because it's closed due to COVID-19. It's an open question. I've been asked this multiple times. If a worker has a family member who is in an at-risk category, so the worker themselves is not necessarily in an at-risk category, but someone in the family is. We don't have a clear answer to that. We've been asked, a number of organizations in state have asked the federal government for guidance. That guidance has not come yet, but I'll post a link to the statute. And I think when we go to the appeal part later, I think a worker would have a solid claim to basically say that because of the pandemic, there is a risk to the health of that worker's family because of the pandemic. But these are all really important to know, just because, if a employer says you need to come back to work, otherwise, and that worker then thinks that they won't be able to qualify for unemployment, there are a number of special qualifications here that would allow them to. And then also just there at the bottom, reach out to the Cabinet for Education and Workforce Development. But as I mentioned, if you're struggling with that, reach out to your local legal aid program, which we'll talk more about later. Go to the next slide. Hand it over to Jessica.
Thanks, Tyler. Just a little bit of background about paid time off, which is one of the rights provided to workers right now by the federal government. Normally, paid time off is not provided by the federal government. This is the very first time that's happening. Nationally, just under 73% of private sectors provide paid leave, and in Kentucky, it's only 62%. And within that, there's a huge disparity on which jobs get the opportunity to stay home when they're sick. 7 out of 10 low-wage workers don't have access to stay home when they're sick. That's things like restaurant workers and home health aides, which are often the most at risk of contracting and transmitting infectious diseases like COVID-19 because of the public nature of their work. So paid time off is disproportionately not given to Black and people of color, and disproportionately not given to women. So it has huge economic benefits to give people paid sick leave and paid family medical leave, income stability for workers and their families, increased productivity at work, reduced turnover, healthcare cost savings for families and for companies. So this is, again, the first time the federal government has provided this. We do not have a paid sick leave law in Kentucky, and in fact, we preempt any local governments from passing one. So it's really great to see this happening right now, and it's April 1st to December 31st, so this applies to all public and private employers with less than 500 employees. And there are some exemptions, including some small businesses or healthcare providers can apply for exemption from this, but most providers are providing paid sick leave right now. So the amount of paid sick leave, there is a limit to it, but it applies for up to 10 days based on the amount of money you make as a full-time employee or as a part-time employee within 2 weeks or about 10 days, and that's up to $511. And for extended family medical leave, that applies to people who cannot work or telework and who are caring for a child whose school or daycare is closed or whose child may be sick. And this is up to 12 weeks of paid family medical leave, but only the first 10 days are paid, and you receive partial pay for that amount of leave. Next slide. So I just wanted to provide some resources, and Tyler helped me gather this together as well. So for UI, if you disagree about the determination and you think you've been wrongfully denied, there is an appeals process you can follow. This is the connection to the appeals branch, in addition to reaching out to legal aid, which we've mentioned and we'll talk more about later. For paid leave, this is the hotline you can call. There's also the Louisville office and a website for those who think that they've been wrongfully denied paid leave that they're owed by the federal government. So I think that's it, and we'll pass it on to the next person. Back to Dustin.
Thanks. So there are some things going on right now to make sure individuals and governments are able to continue to maintain while revenues are down, while jobs are lost. So we just wanted to cover a couple of those things for folks. And then obviously talk about a little bit about later how it's probably, I mean, it's definitely inadequate in order to make sure that we can continue to do that into the future. So let's go to the first slide here. So as folks are aware, the CARES Act provided what are called recovery rebates. I think most people just refer to them as stimulus checks, which is also very accurate. Kentucky received around $4 billion worth of these checks. Many of them made it out the door very quickly to folks who e-file their taxes and receive direct deposits. Many others in other circumstances probably won't see these until later in the year, as late as potentially September, depending on their particular circumstances. The good news is, though, that at the beginning, we weren't sure if Social Security recipients, SSI recipients, SSDI recipients would be able to automatically receive these without filling out a simplified tax return. Since then, they've reversed course on that, and folks should be able to receive this directly, but likely through a physical check in the mail. As a reminder, the CARES Act rebates were $1,200 per adult, $500 per child, up to a max of $200 for each, capping out at $3,400. The benefits phase down, starting at $75,000 for an individual, $150,000 for a couple, and then they phase out entirely at $99,000 for an individual, $198,000 for a couple. So this was really aimed at low and middle class folks, not at higher income folks. And again, the idea is very similar to the PUC benefit that, yes, we want to make sure people can make ends meet, but we also want to make sure there's enough money in the economies that we don't lose more jobs down the road. Additionally, in order to make sure that state governments can continue to provide healthcare and other essential services, the federal share of state Medicaid and CHIP programs increased by 6.2 percentage points, which is around actually a little less than $500 million, according to one estimate. Because the Children's Health Insurance Program federal match is based in part on the Medicaid match, the federal share for CHIP spending also increased by 4.34 percentage points. So, you know, if you break that down, the federal share of Kentucky's Medicaid program will increase from around 72% to around 78% over the next fiscal year. The federal share of Kentucky's CHIP program will go from 92% to around 96%. And then in fiscal year 2021, from 80% to 84%. That's because actually, interestingly, the phase out of the Great Recession increase has just hit Kentucky. So we have just gotten to a point where the federal government was ramping down its share of CHIP spending from the Great Recession, and now it's ramping back up as we hit this COVID recession. You know, this is important not only because Medicaid is the second single largest appropriation in the Kentucky state budget, and so it means that it can potentially eat up a lot of room in our already cash-strapped budget for other things that we spend money on, like education and public health and so forth, but also because we expect and hope to a degree that enrollment will increase in Medicaid over the coming months, and that we ensure as many people as possible have access to medical care moving forward. So let's go on to the next slide. The CARES Act also included something called the Coronavirus Relief Fund, which was direct financial aid or fiscal aid to states and large localities. In Kentucky, the only locality large enough for this was Louisville. They received $134 million. The state received $1.6 billion. The catch with this money is that it is not allowed to be used for pre-existing expenditures as a way of offsetting a decrease in revenue. It has to be spent on new spending directly related to COVID-19, which means that really in many ways, Kentucky's hands are tied. Many of you will probably have heard that the state is hiring a large number of contact tracers as we begin opening the economy back up. They're all being paid almost exclusively through this fund, as well as several testing opportunities and some other things that the state's doing. The other catch with this money is that it has to be spent by the end of the year. So it's a use it or lose it situation. There's some discussion with future COVID relief bills about making this money more flexible so that states can use it to make up for normal spending. That is going to be harder to do with falling revenues, but that at this point is not a guarantee. Additional fiscal assistance for Kentucky includes relatively smaller pots for a lot of different things, including actually a fairly large sum of almost $200 million for elementary and secondary schools, quite a bit of money for CDC prevention grants, $10 million for PPE, for law enforcement, $130 million for public transit, $25 million for homelessness programs, almost $18 million for LIHEAP, which actually has already gone to provide year-round LIHEAP. So normally that is a program just aimed at heating homes, but now it's also cooling homes, which is new and really important. $6 million with assistance for making elections safer, and then $65 million in childcare funding. That's going to be incredibly important to preserve childcare capacity. I don't know if folks remember, but in the last recession, Kentucky had to place a moratorium on CCAP enrollment, our child care assistance program. And when we did that, it really decimated our child care centers in the state. We lost around 30% of capacity in the course of about 3 or 4 years following that decision, which, as it stands now, half of Kentucky lives in a child care desert, which is not only an issue for our workforce who need a place to safely place their kids, but it's also an issue for child development, as we know that the vast majority of brain development occurs between ages 0 and 3, and we want to make sure that there's high quality, affordable childcare available to folks. Having that money there will help continue to make sure it's available. So with that, I will hand it on to Adrian. Adrian, I see one of the questions here is an elaboration of how the $25 million is going to be used for homelessness. You know more about that than I do, so why don't you start there?
Okay. Hi, everyone. This is Adrian Bush. I'm with the Homeless and Housing Coalition of Kentucky. Glad to be with you today. Next slide. Okay. We will talk, the last slide actually talks about the extra federal assistance going towards homelessness and housing across Kentucky, so we will get there. But first, I want to talk about a part of the population who rents. Under the state COVID-19 policies, we have a couple of things going on. One is that we had a very robust statewide eviction moratorium in place. It was implemented at the end of March, and it was statewide. And unfortunately, it's been somewhat weakened since that time. So right now, this eviction moratorium only covers evictions for non-payment of rent. If there are other lease violations that can be documented, then those evictions can proceed. The Supreme Court they issued another order on Friday that clarified that and said that they would begin accepting, they would instruct circuit court clerks to begin accepting eviction filings for other reasons other than non-payment of rent, other lease violations, beginning yesterday. Whereas the rest of it, the other types of evictions, those should not actually be filed until July. If all of this sounds confusing, it is. And it is very unfortunate because a lot of people's lives hang in the balance. I know Ben Carter just posted in the chat a link to kyrenterhelp.org, and that is the easiest way to figure out which legal aid organization, because if you get caught in this situation or one of your clients does, you need legal assistance. KY Renter Help will help you identify which legal aid organization covers your area. Next slide. Okay, so there are some national policies that cover renters. For one thing, public housing authorities, we have a lot in Kentucky, have been encouraged by the HUD secretary to work with tenants due to loss of income and not just, start evictions as soon as possible. That is one of those things where your mileage may vary. Some housing authorities are moving forward as quickly as they can with evictions. Others are not. So again, legal assistance is going to be really, really key. as we deal with non-payment and other issues of renting. There is a helpful tool that is linked in the second bullet point on this slide that was put together by the National Low Income Housing Coalition. I will tell you, I am using it pretty much on a daily basis with people who are inquiring about, I'm behind on my rent, what are my options? First, to see if they are covered by the CARES Act, because any rental property with a federally backed mortgage service is prohibited to evict for 120 days, which that expires about July 25th. Similar to the state eviction moratorium, it does not relieve the tenant of the responsibility for the rent. If they can pay the rent, they should. And then I just want to highlight, there's a link here on the last bullet point. Kentucky Equal Justice Center and Ben Carter have put together a great explainer, kind of a Q&A document about what does all this mean for me, for my clients, for renters in Kentucky. Next slide. For homeowners, there are some protections, again, with the federally backed mortgages, like those through Fannie Mae and Freddie Mac, the Federal Housing Administration. Those suspensions on foreclosures have been extended through June 30th. And then there is a joint website among 3 federal agencies that consolidates CARES Act mortgage relief, renters protections, and resources that might be helpful for you to check out. And borrowers affected by COVID-19 with loan services through Kentucky Housing Corporation should contact KHC. Lastly, on this slide, I do want to talk about utility protections. There is an executive order that extends all the protections against disconnection for non-payment and assessment of late fees for all entities, not just the ones governed by the Public Service Commission. So if I'm pretty sure a lot of them were complying with that voluntarily, but that's another thing that we want to be thinking about is how do we get folks caught up before these orders lapse. Okay. I would encourage you to check out the chat box if you're online. And Ben has an interesting comment about evictions that were pending before the suspension of eviction proceedings. So, thank you, Ben. All right, next slide. Okay. So Beth had asked about increased homeless assistance through the CARES Act. There was a substantial amount of money that is coming to Kentucky. Has it been deployed in communities yet? No. So, but the good news is that it's coming. So the first column talks about community development block grant funding. That is probably the most flexible type of HUD assistance that communities can use. And it can be used for rental assistance. So in the first round, all of the cities on the left-hand side, plus the Kentucky non-entitlement area, which are all the other counties, everybody got funded. The second round, there was about $17 million that will go to the Kentucky non-entitlement area. That is governed by the Department for Local Government, and cities and counties, smaller cities and counties can apply. The Emergency Solutions Grant Program is the funding that is specifically designated for people experiencing homelessness, and it can help support shelter operations, homelessness prevention through payment of rent arrears, utility arrears, that sort of thing. It can help get people housed from the streets or shelter by doing short, medium-term rental assistance. This particular allocation is a little bit more flexible than than traditionally ESG has been, and the income limits are higher than they normally would be under the ESG program. Lexington gets its own allocation, Louisville gets its own allocation, and then the Kentucky Balance of State or non-entitlement programs or areas that are governed by Kentucky Housing Corporation gets about 8.87 million. And then the last column is housing opportunities for persons with AIDS. In Kentucky, Louisville gets its allocation, and the other allocation goes to Kentucky Housing Corporation for distribution. So if you have comments on how you think this money should be spent, I know Louisville has had its first part of its public comment period and has amended its plan in response to that. Kentucky Housing Corporation is drafting their plan. It has to be approved by HUD before they can go through and distribute the funds competitively across Kentucky. But I would definitely, if you are interested in trying to influence that process, feel free to reach out to me and I'll get you to the right place. Okay, and then the last thing I want to highlight for those of you on the phone and can't see the chat box, Ben says, look for a sign-on letter soon to Governor Beshear to take 2 important actions to protect renters now that he and the Kentucky Supreme Court have eroded the protections of Kentuckians who rent. Hashtag healthy at home, whether home is rented or owned. Thank you, Ben. All right, with that, I'll turn it over to the next presenter.
Hi, this is Betsy from Kentucky Equal Justice Center. I'm going to talk about legal aid services very briefly because I know several people have already said that in case of X, you should call legal aid. And so I'm just going to emphasize that if you are a client of yours or someone that you're helping is not able to access some of the help that we've talked about or has been denied help, legal aid is probably who you should call. I don't work for legal aid, but we work closely with legal aid services, and I used to be a legal aid attorney. So Angela, you can flip the next slide, and I'm just going to give you a little bit of background. So a lot of people still ask me what is legal aid, and the short version is that it's free civil legal representation for low-income and vulnerable individuals and families. So just note that that covers pretty much anything unless it's criminal charges. And so if that's the case and the person is low income, they need to call the Department for Public Advocacy. But most other things fall under that. If you're going to get free legal services, legal aid is who to call. I've listed examples of services that they provide. I'm about to talk about, there are 4 different legal aid programs that cover the state of Kentucky. Each of them has their own territory or regions. I'm going to talk about what those are. So just know I've listed the services that most of them cover, but every legal aid program is different. So it is possible that you might call your local legal aid program and they'll say, we are not able to handle X problem right now. But right now they are organizing huge efforts, all 4 legal aid programs in Kentucky, to represent people who have been denied unemployment insurance. And that's not necessarily people who just can't get a hold of the UI, although that still might be a reason to call legal aid, and I'm sure that they'll help to the extent they can. But that's really somebody that's been formally denied UI and needs to appeal that decision. Legal aid has also been working on being able to represent people in eviction. So I listed eviction defense and utility shutoffs by a landlord, or really anything that a landlord does just to get somebody out without taking them to court for an eviction. So we've seen things like taking the windows off of a house or taking the hinges off a door or locking someone out. All those would be reasons to call legal aid. I listed all the types of public benefits appeals that might be handled. Medicaid, Medicare, actually I didn't list them all. I'm sure that there might be more here. You might note that if Social Security is catching your eye, generally legal aid does not take initial Social Security claims. So probably don't call them about that. They're probably going to refer you to find a private attorney because private attorneys can make attorney fees off of those. But if somebody is being cut off of their Social Security benefits, you might want to call legal aid. They also handle overpayment cases if somebody's gotten something saying, we've paid you too much for SNAP or KTAP. they represent people in those types of hearings. They also do foreclosure defense, debt collection defense, bankruptcy, although again, I'll emphasize with bankruptcy that not all legal aid programs have the capacity to do bankruptcy, so some of them might be referring you to another place. And also recognize that not everybody needs a bankruptcy, even though that might be what they want. And so legal aid might also give advice, some other kind of advice about that. And I've also just listed, besides these things that I think apply to what we're talking about today, I've listed a bunch of other categories that some legal aid programs offer. All of them do EPO, DVO, divorce, child custody. There are a few state health insurance assistance programs which help people get enrolled in primarily Medicare and Medicare savings programs at some of the programs. And there are also low-income taxpayer clinics at some of the programs. But I will also say that that is not help filing your taxes. That is help if the IRS is pursuing you over unpaid taxes. Sometimes they can help in those situations, but they do not have, they aren't able to help file taxes for free. Next slide. Okay, so here's the 4 legal aid programs. I've listed them out here, and I've listed their intake numbers. Their intake number is what you'd want to call if you wanted to refer somebody there for a case. It's not necessarily the number you would call if, for instance, you wanted to call and say, I'd love for the person in Western Kentucky who works at Legal Aid to come to my organization and talk about what Legal Aid does. They have office numbers that are on the internet. But I've listed the general regions here, like Kentucky Legal Aid covers Western Kentucky, Legal Aid Society, Louisville and surrounding counties, Legal Aid of the Bluegrass, Central and Northern Kentucky, and Apple Red Legal Aid, Eastern and South Central Kentucky. But the easiest way to find out, all those places are split into, they all cover certain counties. And obviously, if you're along the border of some of those places, it could be hard to figure out who's the right place to call. So I left a link there. It says find out what program covers your county here. And that's a link to the Legal Services Corporation, their website. And Legal Service Corporation funds all of these legal aid programs. And essentially you can put in a zip code or an address and it will point you in the right direction and give you the right number to call. I did that before this. I put in my zip code and I live in Lexington. I got Legal Aid of the Bluegrass, which is the right answer. And generally, rule of thumb is whoever needs help, they should call the legal aid program for the county where they live. There are some exceptions to that, like if the person is being sued and the lawsuit is in a different county. But that's a good general rule of thumb. And if you've called the wrong legal aid place, they'll probably point you in the right direction, but it's helpful to start out calling the right number. So I think that that's pretty much it. Just know that a lot of these problems, like several people have emphasized, legal representation would really make a big difference. And so this might be a good resource to use sooner rather than later. So don't wait too late to call them if you do need help. I'm going to pass it off to who's next.
So it's Sheila Schuster again, and I just want to remind you all that we are in not only a pandemic at a time of great racial unrest, but in a very important election year. Next slide, please, Angela. So as you know, every 2 years, all 100 House seats in Kentucky and half of the Senate seats are on the ballot. Of the 100 House seats, 75 will be on the ballot either in June for the primary or in November for the general election, or in some cases they will have both a primary and a general election. And 12 of the 19 Senate seats, one of those Senate seats is actually being decided in a final election on June 23rd, which is the primary day, because the senator resigned halfway through his term. So a Democrat and a Republican are vying for that seat in Eastern Jefferson County and Oldham County. The primary is on June 23rd. And of course, the big news is that it's going to be done primarily by mail-in ballot. There's been a lot of confusion about the whole mail-in ballot, but they actually have a very workable, very easy to do access for the state portal and it's www.govoteky.com. And they will ask you literally first and last name, last 4 digits of your social security number, home address. If you match the voter registration, then it's a very easy process to complete the form online and to get your absentee ballot. In some areas, particularly in Jefferson County, people were encouraged to contact their county clerk. And so if you did it that way, there's actually a 2-step process where you have to request to get the request for the absentee ballot. So you send that in and then you get your absentee ballot. The important thing is to get it requested by June 16th, and then to get it mailed, it has to be postmarked by June 23rd. And of course, you vote by mailing it in. Next slide, please. So the mail-in ballot is June 23rd. We don't know yet what the process will be in November. There's already lots of talk about doing it also by mail-in ballot. One of the reasons that they're doing it, you remember the news coverage of the primary in Wisconsin, where they had trouble getting poll workers and people stood in lines for hours and hours and hours. And there were a number of COVID positive infections that came out of that. So they're trying to protect the poll workers, many of whom are in the high risk category of being, shall we say, well seasoned on the north side of 60 years of age. There is, at least in each county, one vote in person place. In Jefferson County, it's out at the fairgrounds. But again, for your health and safety and well-being, get yourself an absentee ballot. Mark the request as for a medical emergency and it says COVID-19. The other thing I would really encourage you to do is to get active in your local races. This is the time to get to know your House member or your Senate member. If they're on the ballot, they're going to love seeing you as a constituent, as someone that can vote for them, to get to know them, to introduce them to your neighbors and friends if you support them. Spread the word to increase turnout. Ask people if they've applied for their absentee ballot or not. And let's remember that elections do have consequences. And to quote the Larry Sabato, who is the often quoted guru of political science out of the University of Virginia, elections are decided by those who vote. So be sure to be one of those voters. It really does matter. And on to the next, please, Angela.
Hi, this is Kara Stewart with Kentucky Voices for Health. And since Sheila was just talking about local races, I agree that's very important. But also, we're going to update what's going on in Washington, D.C. So not much outside of people fighting for their lives. But there, a few weeks ago in the House of Representatives, the HEROES Act was passed. And the HEROES Act was initially called CARES 2. It was a follow-up. It is a coronavirus relief fund that is currently waiting to be heard in the Senate. And of course, I'm sure everyone who's on right now with us knows who determines what gets heard on the Senate floor, our very own Mitch McConnell. So Senator McConnell is who will decide whether or not this bill is heard. He has thus far not heard the bill. So we are going to learn a little bit more about it and then hopefully some folks will want to encourage him to hear more about it and call it for a vote. So the HEROES Act does a much better job of creating some substantial economic relief for Kentucky in the face of the COVID-19 recession than the CARES Act did. It goes farther in pretty much every way. So of course, I would still want more. So it does send, because right now we have a big hole coming in our state and local governments because what they're doing has not changed and has increased. So their spending has gone up and our already dismal state revenue is being drained because there aren't payroll taxes and other sources that are coming in right now. So this HEROES Act creates flexible state grants that come into the state that are very different from the CARES Act, which these can be used for the cratering revenues from the budget. And another big thing for our state budget, we've talked about Medicaid, and everybody on here is aware of what a big part of our budget Medicaid is, and this increases the federal share. So bumping it up, we've already bumped it up, bumping that up again makes a big difference for Kentucky. So it gets us all the way up. It's another like 8 percentage points or so. And it changes Kentucky's share of Medicaid and spending by like almost $2 billion over like the next year and a half. A lot, big difference. This is similar for local governments. It also provides supports for workers and families, again, similar to the CARES Act with a $600 weekly benefit. It also extends that PUA that we all heard about earlier, and the PUC, the Pandemic Unemployment Compensation. So that $600 weekly, it extends both of those and also creates a larger round of stimulus payments for both individuals and families. Everybody knows about what Dustin talked about with the $1,200 stimulus payment for individuals, but that had a pretty low cap for families, and this HEROES bill would up that cap to $6,000 for families, which would be much better because it's more if you have more children. And unlike the first round of stimulus checks, this also includes working immigrant households who pay taxes, which might have seemed obvious to be included in the first place since paying into these funds, but this officially doesn't include that. And then also includes more children. It also provides a boost to food and housing assistance. So, you know, SNAP right now, we have that increase that's in existence, but this is the 15% increase that you heard, I think Jessica talk about that we needed, and I know Tyler was talking about that. So this brings it in the HEROES Act, so it's a good bill. There are other provisions in there specifically around homelessness and the extension of services there, and you've heard Adrian talk some about what is still missing in that, and the HEROES Act would go a long way to meeting those needs. It also increases the essential worker pay and safety, and does the Postal Service, which is important for all of us to protect that. And it also provides access to internet access and closing that homework gap that I know we're all aware of for children. Now, what it doesn't do is create the stability that I would like to see in making this an automatic triggered situation. You know, if your unemployment goes too high, then automatically benefits are extended, or so we don't have to have these political fights and have to come in to do another bill to make there be a triggering event that can set up some of these things in the future. And that would be great. This does not do that, so you can include that in your comments if you want. Thank everyone for sticking around. I know people, like Emily mentioned, do have some Zoom fatigue, and I appreciate people being committed to this. There's a lot for us to learn and keep up with as things change day to day. Next slide. Here I was wondering why the slides didn't change because I didn't ask to have it changed. So call Mitch, call Senator McConnell, please. And the spacing of that looks terrible. Sorry, the formatting did not work. But and there's a link that when we send this out to everyone, you can click on that link and it goes to everything I've said and more, and broken down in some bullets and talking points to be able to include in a letter. And Angela just said that she'll take care of fixing that format before it goes out. But all of Senator McConnell's phone numbers are included. I have called I've got all of them actually in the last 2 days. And sometimes you get people that pick up really quickly on some of the others. So feel free to call lots of phone numbers and ask Senator McConnell to hear and pass the HEROES Act, or at least get it together and work together to come up with something that does most of this. This was not a particularly bipartisan bill, so I'm not sure it's got a lot of hope for passing as is. Maybe we can make it better.
All right, thanks, Kara. Of course, that's always our hope as advocates, that we can make these policies better, and we have to use our voices to do that. So we'll be getting these slides out. Angela will make a fix to that slide, but we're also going to be putting a call to action on social media. And I know that KSEP already has a call to action, so please be sharing that with your networks. So I know we're at the end of our hour and a half, but if you just, if you can go to the next slide, Angela. I'll just quickly show you the resources that we have, and then these are all live links. So when you get the copy of the slides, you'll be able to click on these and get more information. And I think you all will know how to find us. We have our email addresses, our websites, and our social media handles at the end of this, in case you have other questions. But We have more resources for renters. We have our benefits explainers that we've done in English and Spanish for things like SNAP, WIC, Medicaid, unemployment insurance. There's a financial assistance application that the Team Kentucky Fund has put out. If you haven't seen that yet, it's on the governor's COVID-19 website, but you can link to it here. There's the map of food banks and other feeding programs. The ACLU Kentucky has recently started bringing together partners to talk about reentry, and they created a really fantastic resource guide for reentry populations, people who are incarcerated and coming back into the community. So we wanted to share that with you. Contact tracing jobs are open right now. They're hiring, the state is hiring 700 people. So if people are interested in that, please share. And the slide is actually just a little bit cut off for me, but I think you can see what else we have there. We can go to the next slide. And then more information about homeless assistance programs that Adrienne talked about. We can go to the next slide. So these are trackers, policy trackers that the Kentucky Center for Economic Policy has been using to make sure that what's happening with Medicaid, with SNAP, our food assistance, and with COVID-19 is being captured in one place where we can make sure we have all that information. We see what the impact of these policies are. It's a really good one-stop shop if you're interested in those policies. So you can take a look at those. We can go to the next slide. And then finally, KVH has some new funding to do story banking. This is something that we did back in, I think, 2014 to 2016. We also worked with Kentucky Equal Justice Center on story banking, and Ryan Morris has been our story bank coordinator. He does fantastic work interviewing people and helping to kind of capture their story and help them tell their story. And we are in particular looking for people to share stories about COVID-19, about health insurance, food assistance, reentry, housing, and more. Really trying to build support for this strong safety net for every Kentuckian. So if you're interested in working with us on that story banking project, you can contact Ryan. There, you have his email address there. And we also wanted to make sure everyone marked their calendars for this monthly advocacy series that we've just launched today. It's going to be the first Tuesday of every month. So those dates are here. We are setting up registration, so we'll be putting that out soon. And the other training that we're going to be doing on June 30th is an Advocacy 101 training with Dr. Sheila Schuster. Some of you may have attended one of these in the past. We did a series of trainings last year and went around the state on a road show, which was fantastic. We're really sad that we can't be doing that this year. But Sheila's going to do this online. We're going to do another Zoom meeting, and the link to register will be open today. I'm going to let Sheila just say a few words about that before we wrap up. And if anybody has any last minute questions that they want to put in the chat, even if we don't have time to answer them right now, we can get those answers to you in our email follow-up.
This is Sheila, and I'd love to have you all join me on June 30th at 2 p.m. I hope to give you some very practical hands-on tips to make your voices more powerful, to give you some insight into how things work in Frankfurt, and give you the sense that you do have a voice and that your voice matters incredibly. And my job is to try to help you by sharing some of my 40 years worth of experience and tips to make your voice more powerful. So I know you all are advocates at heart, so please join me on June 30th at 2. Thank you.
All right, thanks, Sheila. And I think with that, we can flip to the last slide just so that you all can see our contact information. We've run out of time for any live questions, but like I said, we can make sure that you get all the chat history, and if you have other questions, just reach out. And we'll plan on seeing many of you on July 7th. Thanks so much, everyone.